Think about how you navigate a city. You use landmarks, directions, and reference points. Turn left at the gas station. It's just after the coffee shop. The human body works the exact same way. Anatomy has its own GPS system, built entirely around precise directional language. Terms like proximal, distal, superior, inferior, medial, and lateral are not just jargon. They are the coordinates that allow doctors, nurses, and surgeons to communicate with zero ambiguity. Without this system, a description like pain in the upper arm could mean a dozen different things. With it, you can pinpoint any location on the human body as accurately as dropping a pin on Google Maps. Today, we're diving deep into two of the most essential coordinates in that system, proximal and distal. And by the end of this video, you'll never confuse them again. Before you can use any directional term in anatomy, you need a fixed starting point, just like a compass needs true north before it can give you any directions. In anatomy, that fixed starting point is called the anatomical position. It's a universal standard that every medical professional in the world agrees on. The body stands upright, faces forward, arms hang at the sides, and the palms face forward. That's it. Simple, but incredibly powerful. Here's the key insight. It doesn't matter if the patient is lying down, sitting in a chair, or upside down on an operating table. Every directional term, including proximal and distal, always refers back to this locked baseline position. This universal agreement is what makes global medical communication possible. A doctor in Bangladesh and a surgeon in New York are always speaking the same anatomical language.
Now we get to the heart of today's lesson, the proximity matrix. There are two opposing terms here, and understanding them together is the key to mastering them. First, proximal. Proximal means situated close to the center of the body or close to the point of attachment of a limb. Think of the word proximity, nearness. If something is proximal, it is near the anchor. Second, distal. Distal means situated away from the center of the body or away from the point of attachment. Think of distance. It is far from the anchor. Picture a bullseye target on the shoulder joint. Everything moving toward that center is proximal. Everything radiating away from it toward the fingertips is distal. These two terms are always used relative to each other, which brings us to the next incredibly important concept. Here is where most students make their biggest mistake. They think proximal and distal are fixed labels stuck to specific body parts forever. They are not. They describe relative distance from an anchor point, and that anchor can shift depending on what you're describing. Take the elbow as an example. The elbow is distal to the shoulder because it is farther from the body's center than the shoulder is. But that same elbow is proximal to the hand because it is closer to the body's center than the hand is. Same structure, two different descriptions. Both are correct depending on your reference point. This is the relativity ruler. The elbow sits at a middle point on the ruler, and its label changes based on which direction you're measuring. The takeaway, always ask yourself, proximal or distal, compared to what?
Let's make this real with a clinical example. Imagine someone says, "I have a tattoo on the proximal end of my right forearm." Using our anatomical GPS, we can decode this precisely. Step 1. Identify the anchor. The forearm's point of attachment is the elbow. That's our anchor. Step 2. Proximal end means the region closest to that anchor. Step 3. Result: the tattoo is near the elbow region of the forearm, not down near the wrist. Without anatomical language, you'd have to say somewhere in the upper part of my forearm, near the elbow, I think. With it, you say proximal forearm, and the location is instantly, precisely understood by anyone with medical training. This is exactly why this language exists. Efficiency, clarity, and zero room for misinterpretation in clinical settings. Now here's a critical limitation you need to know. Knowing that something is on the proximal end of a limb narrows down the position along one axis, the length of the limb. But it doesn't tell you the full story. Is the tattoo on the front of the forearm or the back? Is the injury on the inner side or the outer side? To complete the anatomical map, you need a second intersecting axis. That's where the terms dorsal and ventral come in. Dorsal refers to the back surface, ventral to the front or belly side. Together, proximal distal and dorsal ventral work like a coordinate grid.
giving you precise two-dimensional location data anywhere on the body. Anatomy is never just one term. It's a system of overlapping, intersecting coordinate grids working together. Master them one pair at a time, and the full map will come together.